Welcome to the final lecture in our Aerospace Medicine Seminar Series. Today we will be covering space physiology. My name is Natasha Cho, one of the core faculty members of the UTMB Aerospace Medicine Division. I'm board certified in Aerospace Medicine and Emergency Medicine and a graduate of the UTMB Aerospace Medicine Residency, class of 2015. This presentation uses material from the original mini-series curriculum and expands upon it in the 2024 update. Our residency and associated projects are funded in part by NASA. As a disclaimer, the content in these presentations serves as a basic introduction to aerospace medicine concepts for students. It is not a substitute for formal ACGME-accredited aerospace medicine training or aerospace medicine work experience and shall not be used as such in medical practice or decision-making. This material, including text, images, and multimedia, is protected by copyright and other intellectual property laws. The content is provided for informational purposes only and may not be copied, reproduced, distributed, transmitted, displayed, modified, or otherwise used in whole or in part without the express prior written permission of the University of Texas Medical Branch at Galveston. Today we will be covering the following objectives. This will be a brief introduction to space physiology. First, we will discuss physiologic adaptations to spaceflight. This figure depicts the various adaptations that occur in relation to time spent in space. The first adaptations are neurovestibular. Let's look at these more closely. The neurovestibular system is the first that must adapt to weightlessness. The incongruence with what astronauts see from visual input and what they experience from vestibular input can cause a phenomenon known as space motion sickness, or SMS. Symptoms range from mild to severe and can result in vomiting. The photo on the bottom right is a reminder of how fluids behave in weightlessness. The same is true for vomit as it is for water, so you can imagine that vomiting in space is not ideal. The onset of SMS can be immediately after reaching orbit and last through the first few days of spaceflight. The duration is typically 2 to 3 days, but some have been inflicted for as long as 10 days. As you can see from this slide, SMS is very common, particularly in first-time flyers, with an incidence ranging from approximately 33% of Apollo astronauts to 72% of shuttle astronauts, and approximately 45% of ISS astronauts based on available data from ISS missions between 2009 and 2024. Note that the incidence also tends to increase with increased spacecraft cabin volume. This is the International Space Station. Due to weightlessness, there is not a necessity to have a floor and ceiling like we do terrestrially. This makes all of the walls functional space. You can appreciate how this can be disorienting, especially when floating and changing your attitude in relation to the space station. As discussed in previous lectures, countermeasures are measures used to mitigate a problem or challenge. Moving less in space is helpful to prevent SMS symptoms, particularly fewer and slower head movements. Regarding orientation, most astronauts find that initially, creating an artificial up versus down orientation is useful to prevent disorientation. They then orient themselves to an arbitrary vertical to minimize symptoms. Similarly, planting their feet and crouching down to retrieve items rather than inverting their entire body can minimize disorientation in the first few days of spaceflight. There have been many accounts from astronauts about new arrivals to ISS and how they are easy to spot based on their behaviors. Those who have just arrived tend to be very purposeful about their movements compared to someone who has been there for a long time. Astronauts who have been in space for prolonged missions will invert themselves readily and typically use their legs to hold onto station and carry items. Recently arrived astronauts have not figured this out yet. Extravehicular activities, or spacewalks, should ideally not be scheduled within 48 hours of arrival in space due to SMS risk. The gold standard treatment for SMS at this time, based on available NASA data, is promethazine, also known as Phenergan. Other medications have been used in an attempt to prevent and treat SMS, but have not shown statistically significant improvement over placebo. It should be noted that all SMS medications carry the risk of anticholinergic side effects, including urinary retention. Sedation from promethazine does not appear to be as common in spaceflight as when given terrestrially. This is presumably due to the increased adrenergic response related to the excitement of launch day and early spaceflight mission operational tasks. SANS, or Spaceflight-Associated Neuroocular Syndrome, is another phenomenon that takes place in spaceflight. Since the shuttle era, there have been reports of vision changes by astronauts. This is more common in the right versus left eye and more common in men than women. SANS has objective findings as well, such as hyperopic shift or increased nearsightedness, as well as some of the other findings you see here on the right. Some of these changes have been permanent in some cases. The top image displays choroidal folding of the retina. Pre-flight images are on the left and post-flight images are on the right. The bottom image displays globe flattening and optic nerve sheath edema. SANS remains a topic of much research as it raises implications for long-duration spaceflight, and the etiology appears to be multifactorial in nature, so there's no definitive countermeasure at this time, only occupational surveillance. Let's move on to the cardiovascular system. You can see from this image that terrestrially, blood pools in the lower extremities due to gravity when standing. This results in a MAP, or mean arterial pressure, of approximately 200 millimeters of mercury in the legs and 100 at the level of the heart and 70 at the level of the head. During spaceflight, these locations are relatively equal in pressure because the effect of gravity has been removed. This results in facial puffiness and congestion. The legs appear thinner. This is sometimes collectively referred to as puffy face, bird legs. In the post-flight period, gravity again takes effect, and there can then consequently be a risk of orthostatic hypotension. Here is a contrast of Dr. Serena Onion Chancellor terrestrially and in space. You can appreciate that in the photo on the right, when she is in space, her face is more red and fuller than in the photo on the left when she is on Earth. Facial erythema results within minutes of arrival in microgravity, whereas facial fullness or edema occurs within minutes to hours. Astronauts have also complained of uncomfortable sinus pressure within the first few days of spaceflight, but generally this becomes more tolerable thereafter. There are many physiologic changes to the cardiovascular system in space, but the take-home is that there are no functional impairments to this system during spaceflight. Heart rate decreases slightly in the first few weeks, but long-term may normalize. Stroke volume and cardiac output initially increase, then decrease. Cardiac output increases initially due to the increased stroke volume and cardiac filling from the fluid shifts that we just discussed. Plasma volume decreases by 10 to 15% due to increased capillary permeability and extravasation. There is also a 10% reduction in red blood cell mass due to selective hemolysis of new red blood cells. Additionally, decreased baroreceptor responsiveness is also noticed. Arrhythmias are rare in space, and the few that have occurred have all been clinically insignificant. We mentioned that astronauts are at risk of orthostasis when they return. Countermeasures for this have included oral fluid loading protocols prior to return with water and electrolytes, as well as donning orthostatic compression garments. Of note, the neurovestibular system is also at risk upon return to Earth with re-exposure to gravity. Vestibular disturbances are common, and precautions similar to those advised for minimizing SMS symptoms are employed, namely decreasing head movements and using medications as clinically indicated. The pulmonary system also has many physiologic changes in space, as indicated by the table on the left side of this slide. But again, despite these many changes, there is no functional impairment to this system in space. Oxygen uptake and carbon dioxide ventilation are unchanged in microgravity. Exposure to higher levels of CO2 in space is a concern, however, because the spacecraft must be capable of scrubbing CO2 out of the system, and in microgravity, there is a lack of convection to move CO2 away from the individual exhaling. This is particularly true in confined spaces. Other pulmonary considerations in microgravity are listed on this slide. Aspiration is a risk in space due to particulate matter floating in the spacecraft. As alluded to in the previous slide discussing CO2, there is a need for forced air circulation, HEPA filtration, and scrubbing of CO2. To minimize risk of toxic exposures, unloading certain payloads also requires extra precautions, such as mask donning. Next, let's talk about musculoskeletal concerns in space. The body assumes a neutral position in space, as depicted here. Back pain is very common in space, with an incidence of approximately 60%, typically in the early phases of spaceflight. It has been theorized that forcing the body out of this neutral position for sleep, exercise, and work may be a possible contributing factor, as well as spinal elongation due to lack of gravity. Other possible contributing factors include spinal muscular atrophy and disc changes. Countermeasures include designing the crew and work sleeping stations to be more ergonomic to this new neutral body position. Bone mineral density loss from weight-bearing areas such as the pelvis, lumbar spine, and lower extremities occurs during spaceflight. Crew members on missions greater than 3 months can experience up to 10% loss in bone mineral density, and ranging anywhere from 0.3% to 1.5% loss per month based on Skylab and ISS studies. There is also reduced intestinal absorption and increased urinary excretion of calcium. This places crew members at increased risk for kidney stones. Finally, parathyroid hormone levels have been variable. The data has been mixed, and the length of the mission likely plays a role in this. Muscle atrophy is a known complication of spaceflight. This occurs primarily in the postural muscles and lower extremities. Typically, there can be a loss of approximately 10% for missions longer than 3 weeks. Musculoskeletal injuries are also a concern. We know from training that the EMU, otherwise known as the Extravehicular Mobility Unit, or spacewalk suit, can cause hot spots as shown on the left. The graph depicted at the bottom of this slide shows the prevalence of injuries by location. You'll note that the hand has the highest prevalence. This is because astronauts are constantly working against the pressure of the suit with their hands as their primary means of locomotion in space. Fingernail delamination is also common. There are currently 3 exercise devices used by US astronauts on ISS to mitigate muscle atrophy and bone mineral density loss. These are ARED, or the Advanced Resistive Exercise Device, CEBIS, the cycle ergometer with vibrational isolation system, and the T2 treadmill, sometimes also known as Colbert, the combined operational load-bearing external resistance treadmill. Shown here are images of these devices aboard ISS. On the left is CEBIS, in the middle ARED, and on the right T2. There are also unique risks for sleep in space. Every 90 minutes, the ISS circles the globe, meaning that every 90 minutes, or 16 times a day, astronauts experience a change from light to dark. This is very disruptive to normal circadian rhythms. Also, depending on activities on ISS, such as a new cargo vessel or crew arrival, they may need to sleep shift or change their hours to accommodate the task. ISS is an extremely busy laboratory, and astronauts are tasked with running it, so work overload is a concern. Finally, the spaceflight environment of weightlessness, higher CO2 levels, different lighting, and levels of noise may also affect sleep. Lack of sleep carries the risk of performance errors and mission loss. Sleep and circadian countermeasures include individual private sleeping quarters, as demonstrated in the photo on the right. Blue light therapy and caffeine are also utilized. Scheduling makes every effort to avoid slam shifting and incorporates recommendations from the Fatigue Management Service at NASA. Astronauts have sleep aid medications available to them as well. These are all ground tested prior to flight in order to identify and minimize risk of deleterious side effects. We'll close this lecture by discussing analogs. These are environments used on Earth to try to simulate, to the best of our abilities, space. Microgravity is simulated by parabolic flight, which can achieve microgravity for approximately 30 seconds at a time. The NBL, or Neutral Buoyancy Lab at NASA, is another microgravity analog. Gravity cannot be overcome in the pool, but neutral buoyancy can be achieved, and thus it is used as a training facility for EVAs, or extravehicular activities, otherwise known as spacewalks. There is a mock-up of sections of ISS in the pool, and astronauts train in this high-fidelity environment to learn how to complete building and repairing tasks in their spacesuits on the exterior of ISS. Head-down tilt is an effective analog for the fluid shift we discussed earlier that we see in space. The photo on the bottom demonstrates a treadmill used in the past for fluid shifts with patients on bed rest in a head-down tilt study. Other analogs address telecommunication, communication delays, isolation, and altitude. Examples include HERA, the Human Exploration Research Analog at JSC, for which NASA periodically takes volunteers, High Seas, the Hawaii Space Exploration Analog and Simulation, Mars 500, a Russian analog in which crews simulate 500-day missions, and also analogs for altitude, such as hypobaric chambers and high-altitude operations. All of these analogs allow for high-fidelity research and training. So now it's time for a knowledge check to see what we've learned. Question 1. What is the primary cause of astronauts having puffy faces and skinny legs immediately after arrival in space? A. Muscle atrophy. B. Fluid shift. C. Histamine response to particles in the space environment. D. Positional changes from launch. Or E. Space motion sickness. The correct answer is B. Fluid shifts cause facial edema and a relative cephalad shift of volume from the lower extremities. Question 2. Which of the following is not an example of a countermeasure for the physiologic and environmental changes that occur in spaceflight? A. Resistive exercise. B. Cardiovascular exercise. C. Blue light therapy. D. Stimulated microgravity. Or E. Forced air circulation. The correct answer is D. This is an example of an analog environment, not a countermeasure to mitigate the physiologic effects of spaceflight. Question 3. The following are replicated by existing analog environments except A. Microgravity. B. Communication delay. C. Fluid shifts. D. Altitude. Or E. Artificial gravity. The correct answer is E. Creating artificial gravity through rotation and centrifugal force has been proposed in many science fiction models of spaceflight, but outside of terrestrial centrifuges used for mimicking launch and landing dynamic forces, this is realistically not used as a sustained spaceflight analog environment. This concludes this lecture. References are listed here. We'd also like to give special thanks to Dr. Amy Krakis, UTMB RAM graduate, class of 2020, who created the original version of the UTMB Aerospace Medicine Seminar Series. And special thanks to Ms. Heather Medley for her tireless work in reformatting and updating the seminar series as part of the 2024 revisions. Thank you for watching this presentation. We hope that you enjoyed it. If you have any questions, please don't hesitate to contact us at the email listed here.